Welcome back. This segment is furnished by Bengtson Center for Aesthetics and Plastic Surgery. There's a new show on the E! channel. It's called Botched, where a couple of plastic surgeons have teamed up to help fix folks who've had botched plastic surgery. Well, this prompted us to want to do a segment on some of the most common surgeries that may have the potential for botching. Registered nurse Amanda Gorder and Lisa McNeese from the Bengtson Center are here to talk with us about this. Good morning to both of you.
Good morning. Hi.
This is a fascinating topic because there are so many more procedures that are easily accessible and make real positive changes for people, and yet I think sometimes just hear the horror stories. It's a potential, isn't it?
It definitely is. And I think people also hear the word or the term plastic surgery and they think a lot of vanity goes with that, and that's not necessarily true. I can speak from my own experience. I had significant weight loss over the past 7 years. And so with significant weight loss comes excess skin in many areas of your body. So I had a tummy tuck, abdominoplasty, and I've also had a breast augmentation due to having 3 children and nursing babies.
But I understand that maybe it's not the tummy tuck or the breast augmentation that is most easily botched. What are the surgeries that are sometimes the ones that give us fits?
Well, the most common one that we see at our office, just because Dr. Bengtson is well known for his breast surgeries, are botched breast augmentations.
So, is that right?
So Dr. Bengtson is very well known for all of his revisional breast surgeries. So we have a lot of people all over the country that come to see him to get things fixed.
Yeah. Like lumpy bumpy, you know, what are the commonly happens?
Yeah, a lot of people, you know, go in it having unrealistic expectations. Some people go way too large, or they see a plastic surgeon that just isn't experienced enough, and you know, things
Repairs
can go
are
wrong.
in order. What about also too? I understand a lot of the fillers and a lot of the things that people are doing with their faces. That sometimes those go wrong.
Well, you know, in like Beverly Hills where the show is or whatnot, they do a lot of like silicone type of injectables, where here in West Michigan that's not really as well known. We do a lot of different fillers with hyaluronic acid, which is something that it's not permanent. It's something that can be dissolved if something does go wrong. So we don't see that as much, you know, in this area.
I suppose that also gives you a more natural outcome as opposed to
Definitely
putting silicone in there.
Right, yep, and hyaluronic acid is a very soft gel-like substance, so it looks very natural.
I think the key is finding the right doctor. So let's talk about that process so people can find a good match in your search for the right experience. What kinds of questions do you ask? What do you do?
Number one, make sure that your physician is board certified plastic surgeon. That is key. You know, they have had the extra training, they have done what they need to do in order to take care of me. The other thing is that I wanted to talk to other people who have had similar or the same procedures that I was having done. I wanted to hear about their experience. I wanted to hear what their outcome was. I really wanted to get their opinion on what they thought was important going into it. That then helped me to form questions when I met with my surgeon to ask, you know, what was it that I needed to talk to him about? Yeah. And from there, it was really an interview process for me as the patient so that I could talk to the plastic surgeon. In our office, we do recommend that you get another opinion. You know, we want to make sure that our patients are well informed and that they have done their homework.
So, and it's not tacky, and in fact advised to say, give me references.
Absolutely. Absolutely. We have patients who have had phenomenal outcomes who are so happy with their results that they are willing to go and talk to other patients. You know, there's a whole HIPAA component to it, a confidentiality piece that we make sure is kept in place. But we do have patients who are happy to talk to other patients and can talk to them about their experience.
I suspect it is about developing a relationship of mutual trust and really sort of a shared vision for what's going to happen to your body when you're there.
Yes, absolutely. And you know, there's pros, there's cons to every type of surgery. And so, you know, I think that's one of the things that our team, and Dr. Bengtson especially, does so well, is make sure that people understand the risks, make sure that you understand what your outcome is going to be, as Amanda talked about with realistic expectations. We want to make sure that, you know, what you're hoping to achieve is what we can deliver.
Is there anything that can't be fixed?
I would say there's always something that can't be fixed, but you can always improve. So I think the improvement piece, and again, that sets up the realistic expectations that Dr. Bengtson does so well. we have some technology available that also helps us accomplish that. And do you want to talk a little bit about the Vector 3D imaging?
Yeah, we have a 3D imaging system at our office for anybody who's seeking breast augmentation surgery. It takes a 3D photo of your breasts, and it can simulate or put different sized implants in so that you can see what your outcome will potentially be.
So there's not that
Exactly.
right. Moments.
Right. And we actually have a newer component to it too, where it shows the mastopexy or the breast lift portion as well. So that can really help somebody as well.
Well, establish that relationship, do your homework, ask for references, and if you get into trouble, there's hope, and that's the good news.
Yes,
yeah, thank you
absolutely.
both for being here. Appreciate
you.
that.
Thank
You
you.
can find contact information on the Bengtson's practice on our website. Go to WZZM13.com under Take 5 links.